Ngayon sa yung kay Victor, no? Maraming po silang ino-offer dito. Pag-uusapan po natin yan nang malaman po ng ating mga kababayan kung ano po itong Britannia Victorians. They have so much surplus income. A lot of them are going to cosmetics, right?
Yes, that is true.
They already look good, but they want to look better.
Actually,
and feel better.
The Korean, even not Korean, the Japanese Korean, they believe it's not spend money. It's one of the biggest invest for their bright future.
For health.
Yeah, for health too. Right?
If they spend for health, that's a good investment.
Yeah, of course.
O nga naman mamamatay ka rin ba? Hindi ka pa magpapahaba ng buhay. Tsaka yung maganda, comfortable, may comfort habang tsaka maganda yung itsura mo. Diba? So, ano-ano lahat itong mga ino-offer natin dito kasi dami kong nakikita. Pati yung mga kaibigan kong barkada dyan. Merong ano dito, ha? Sige, will you please discuss this, Dr. Tan?
Okay. Well, for cosmetic services, we have cosmetic surgeries. Everything that our patients usually request. Usually,
it's
one of the most...
available.
Yes. All available. From the conventional surgeries up to the new machines, we tried to make everything complete. So, like for example, for hair removal, we have the lasers. For non-surgical weight loss, we have radio frequencies. It's like an ultrasound that we just do, and then it melts the fat. And then if the patient really wants surgeries, then we do the surgical procedure. We also have anti-aging medicine. That's the trend now. Sometimes we're trying to make ourselves look beautiful outside, and yet from the inside we're lacking.
Okay.
So we're trying to go more into anti-aging medicine also. We want to prolong life, and then we also want to make life more comfortable to live with. Kasi sometimes people would make us live long, and yet hindi na natin kaya, nangihina na. So that's one thing that we want to do. Live life and then live it to its fullest.
Na-enjoy mo, no?
Yes.
Marami kang pera, na-enjoy mo rin yung pera mo.
Exactly.
Hindi mo gagastusin yan, hindi mo ma-enjoy. Ano bang working hours mo dyan?
Well, we start at 7 for the laboratory. Starts at 7. Usually because we have fasting blood extractions for patients. So we open at 7. And then the medical and the dental, they open at 9 o'clock. And then the cosmetic.
Hanggang anong oras siya?
Up to 7 p.m.
O yung cosmetic?
Up to 7 p.m.
So ngayon, nalalaman na ba ng tao yung sa cosmetic part? Everybody who goes there, ano naman yan, tinitreat ng hindi nalalaman ng iba unless na gusto nilang ipalam na sila doon.
Yes, actually, that's one of the things that we take pride of, confidentiality.
Confidential lahat yan.
Yes. Well, even if the patient is a famous personality, no one will actually know that they were there.
Kahit na celebrity siya, tapos nagpa-vaginal rejuvenation siya.
Yes.
Walang makakalam nun.
Yes.
Ano ba yung tawag doon sa yung vaginal rejuvenation? Landscape?
Yes. Flower arrangement.
Flower arrangement. Pero, kasi merong pangit, di ba? Naayos niyo yun.
For me, no such thing as pangit. No. It depends on the patient. Yes.
Hindi, meron di maganda.
Yes, everything can be enhanced. I think that's the term.
Okay.
Yes.
Everything
can be enhanced.
Everything can be enhanced.
Yes. So it's a preference for the patient. If the patient is okay with it, then we're okay with that.
Because a lot of people are now, they go to Hong Kong, they go to Thailand for this purpose. Right?
Actually, we have a lot of patients that have already bookings in other countries, and then they learn about Britannia is just near.
Yes.
And what they're actually after is actually the aftercare. Because that is something that sometimes they cannot have in other countries. They just do the procedure, they have to leave. After that, the doctor forgets about them.
Walang tender loving care.
Yes.
Di ba? Kaya daw yung mga nurses na Filipino, mga doctors in demand, yung mga caregivers, because of the tender loving care, which is inborn to every Filipino, right? Yung inaalagaan nyo. Dito kayo, alam yan, mag-aalagaan.
Definitely.
Akala ko hindi nyo alam. So, you know that about Filipinos, our advantage is we really take care. Even if you don't have to. Even it's non-personal when you take care of a patient in the hospital. there's the Filipino healing touch.
It's a part of the culture.
Part of the culture, yes.
Okay.
You know that, right?
This is why
That's
our
why you stay
doctors,
here for...
this is why our doctors and our nurses are known as the angels of mercy. Right?
So ano ba? Ano ba yung mga wart removal? Yung mga simple,
Yes,
di ba?
we have.
Procedures. Yung mga moles,
Yes.
natatanggal din yan.
Scar revisions also,
Scar,
we have
oo,
that.
yun. Tapos yung ano, tummy tuck.
Yes.
Okay, yan.
Ah.
Pero yan, ano yan? After you do it, pwede nang lumabas?
The tummy tuck is a major procedure,
Major
so
yan,
we
di
do
ba?
it in the hospital of choice of the patient.
Okay. So,
So,
you do it not
yes.
there, but okay.
Yes.
And you have arrangements with the other hospitals.
Yes, but we also give our patients a choice.
Oh.
So wherever they want, and then we can do it.
You just do the procedure.
We will arrange
there.
everything.
Okay. So,
And also with the other services that we have, our rule is always we don't want to say no. We don't know and we don't have it. Usually what we tell patients is, if they're really requesting for it, we
Yes.
tell them, as of the moment, we don't have it, but if you want, we'll coordinate and look for it so that we can actually bring it to you instead of you going to another place. So I think we're more of into the
Hahanapin niyo sila ng
convenience.
solusyon.
Exactly.
hindi yung i-stop nyo na sila.
The thing that
Hindi kasi,
I don't like hearing the most is when they say, hindi namin alam eh, or
Oo.
wala kami niyan. And then after that, it's a blank stare.
So I expect your people, like the nurses here,
Yes.
yung pati sa receptionist, alam nilang makipag-usap sa tao.
Oh, yes.
Part yan, di ba?
Yes.
So kakayanin nyo.
Kakayanin.
O hahanapan nyo ng solusyon. kung ano
Hanapin
man
ng
ang-
solution. And then, hindi lang yun. Hindi lang yung pwede na. We want to get the best also and then
Oo.
bring them here.
Di pwede na eh. Dapat
Yes.
yung better than pwede na or the best.
Yes. Actually, one of our sayings is, better is possible than good is not enough.
Okay. So, ma'am, ilan ang dentition nyo doon?
Bali po.
Pero ba nagpatanggal din ng ngipin doon?
Opo.
Kala ko yung simple, hindi nila ginagawa.
Kahit lahat ng ngipin, pwede.
Yung doon ako meron trabaho doon. Kayo, narinig nyo sinabi ni Doc, hindi nyo pinagsasabi ako sino nagpupunta doon, nagpapaayos. Unless na gusto mag-model, no? Kumari, nagpunta sila doon, tapos gusto lang...
Yeah, but we still leave it up to the patient.
Di,
Gusto niyang ipagsabi na may ginawa, then we're okay with that. But
Oo.
kami wala.
pero ngayon,
Hindi kami mapipiga.
ordinaryo na ngayon, di ba? Yung may ginagawa, di ba? Ordinaryo na ngayon sa Philippine yun. Maraming What's the most common procedure?
Well, up to now, the most common procedure would be liposuction. And,
Liposuction.
yes. The second would be the eyelid repair, usually
Eyelid.
with double fold. Yan.
Okay.
We usually do that. For the non-surgicals, we still have the diamond peel, the radio frequencies, the lasers.
Yan, common yan. So yung ano naman, yung tummy tuck, hindi mo masyado yan.
Well, tummy tuck has been around for a number of years already.
Yes,
but
pero-
we offer it, but we also tell the patients, why do you want to have it done? So if they tell us, because I want the excess skin to be taken out, ganyan. So we also offer options. Okay, we tell them, okay, you have first option, tummy tuck. Second option, we have a mild, it's like a minor procedure, which is liposuction, and then we just do the machines to shrink the skin. And then if they don't want any surgeries, or like for example, if the patient has a medical condition, we offer them non-surgical.
Non-surgical,
Yes,
non-invasive.
oo.
Okay, let me ask. Nagpa-Brazilian wax ba kayo doon? May Brazilian wax doon sa inyo? Wala. Wala kayo. Gawan nyo ng paraan.
Yes, actually we can offer something better than the Brazilian
Ano ba yung
waxing.
better sa Brazilian?
Because with the Brazilian waxing, they would do it every few days, few weeks, and then the pain also. So what we can do is we can do it with lasers, which would make it permanent.
Permanent?
Yes.
Okay, yan.
Oo.
Menos ng blade yan.
Menos ng blade, menos ng sakit.
Tsaka yung wax.
Yes.
Mag-break daw tayo. Very interesting po discussion namin. Hindi po kami nahiya magtanong. Ako hindi ako nahiya magtanong kasi these are probably questions that the audience out there would like to ask them, but they're afraid to. But I'm not. Babalik po ako.